sometimes it can bring up emotions. People cry. I know the first 2 days I did the shaking and dancing exercise, I got tearful, with what was going on. I wasn't even feeling that emotional state.
Welcome to the Health Pilots podcast, presented by the Center for Care Innovations. This podcast is about strengthening the health and well-being of historically underinvested communities. Every episode offers new ideas and practical advice that you can apply today.
Welcome, everyone, to this peer workshop on taking time for self-care during the workday. And we are so thrilled to have Dana Valley from West County Health Centers to share a little bit about their organization's journey into integrating a variety of self-care practices into their workday. So we would just love, Dana, if you can say a little bit about yourself and why this work has become so important to you and to West County.
Thanks for having me. Yeah, this is so exciting to get to share some of this with a broader audience. And I loved how you called it ritual, because in the work that this is all based off of, rituals actually very, very important. And it's what separates the mundane from the special. And I think, when we get into body, mindfulness type of things, creating that container of specialness is super important. I have a personal story, which I won't go into too deep, but I got really sick in 2009. And, I work in healthcare, and I, went to my friends that are doctors, and I was left with basically, being told there wasn't anything that anyone could do. And I was supposed to monitor my symptoms and manage my symptoms. And I started seeking alternatives. And that really put me on this whole path of getting into alternative medicine, but also opened up a lot of spirituality, which is intertwined with medicine. And that was surprising. And I didn't understand that, didn't realize how important that was. When I talk about spirituality, it's not religion. I'm not talking about religion. We're talking about our connection. So our connection to ourselves, our connection to each other, our connection to our place in the world. That's what gives us meaning. It's what gives us purpose. And I think what's so in our face right now in the current state is that connection being cut. And for us and for our patients in the communities we serve. And going through this, my own personal experience, the thing that's been in my real job, working in healthcare, the thing that's been so in my face is how, as healthcare leaders, and that's all of us on this call, we've done such a disservice to our patients, to our families, to ourselves, to the communities we serve by eliminating spirituality from whole person care. And we're going to see the repercussions of that. We already have. My organization, Santa Rosa Community Health Center, and several other community-based organizations formed the Sonoma Community Resilience Collaborative in response to the fires in 2017. And wanting to develop resilience in our communities, we were absolutely just devastated by those fires. And since then, we've had another fire and floods, and now this. But what the collaborative did was brought in the Center for Mind-Body Medicine, which is based in Washington. And what that organization has done is they've taken all of these sacred practices, these, traditional practices around mindfulness, meditation, so many tools and skills that have been used for eons, and taught the science behind that and taught the evidence. They are evidence-based practices. And then packaged them, was able to articulate the language around it. So there's a shared language. And I say that because, when you dip into, some of those spiritual practices, those mindfulness things, you get into the woo-woo and the language kind of gets a little funny. So for example, a healing arts practitioner might use the word someone's ungrounded, where a psychiatrist would use the word, psychologist would use the word they're disassociated. And they're both saying the same thing. So the Center for Mind Body Medicine really packaged things in a way to show the effectiveness of these skills and these tools, and then designed an absolutely effective way to get that stuff into a community. And they've done work in, they went in after 9/11, post-war Kosovo. They've done big, gone into communities that have had huge tragedies. And their technique is to train thousands to heal millions. So by training leaders in these community-based organizations to then train the people that they serve. So it's a really effective way, kind of a train the trainer, really effective way to get these skills out. And then they've also packaged the skills so that they can be delivered in a really effective model. And the delivery is also the medicine and the healing. So it's typically taught in a 2-hour, once a week session for 8 weeks with a small group. And so that group really forms this connection. It's very, very powerful. Some of you on the call have been through some of the groups. Beautiful, beautiful. So as I was honored to go as one of the people in our organization to go through the training and then be charged with, and of course this is also kind of wrapped into trauma-informed care and wellness initiatives. This wasn't like some fun thing to go do. To be able to become a trauma-informed organization, a healing organization for our staff and our patients. And so I was then tasked with delivering those 8-week sessions to our staff. And our organization has committed to having our staff go through these trainings. And at our organization, we've done a total of 6 8-week sessions. We had to cram it from 2 hours to an hour and a half. And our staff was doing this on the clock. So they actually got paid to attend these sessions. Fantastic, fantastic. Then all this stuff happened, right? And immediately, like a 2-week session doesn't fit anymore. And if we can't take those tools, that all of those mind-body tools, and integrate them both for ourselves personally and get them into, institutionalize them in some way, then what's the point? So I personally, totally selfishly, I needed reminders to meditate and breathe and do my own personal practice at work. And so started the Caring for the Caregiver series. Yeah.
I have a question about that. You said that you were doing it for yourself. So was it only on your calendar at first, or did you?
The very first day. Yeah. And then I added my friends at the organization. And I was like, heck, I'll use your email. And then I went through my Outlook and anybody I knew, I didn't do all my contacts. I thought that'd be a little rude, but I started adding other people because as we went in through the first week of shelter in place, it became really apparent in the healthcare system, we need some support. We need some serious support. So I just, cold emailed people to join in. And I've, some people declined. Some people declined a few times, but, that's okay. And I've had, some people email me back. The time slots don't fit in, but I really appreciate the reminders.
What's happened since you started? It sounded like it sounded like there are people from other organizations and things that you have attending.
Yeah, there's quite a few people on the call who's attended too. And there are a few people who attend literally every single day. I have a retired nurse at home who's in the older age category, basically wants to help, wants to do something. She's sewing masks at home and she gets on the dance party every single day. And that's her method of connection. What would be awesome is to be able to do things like this for our patients. I think there's an acknowledgement that we in healthcare, first of all, need to take care of ourselves and to recognize that these skills are really powerful. And these skills have a place in self-care, in healthcare. And how do you put meditation into the healthcare system, for patients? How do you put some of that into our healthcare system where it would ultimately benefit the community if we're not doing those practices ourselves?
Dana, could you describe what you do, the types of sessions you run?
Yeah, sure.
And how people experience it?
Every morning, 10 o'clock, I open up a Zoom room. I play soft music. I'm actually recording every one of those sessions, and then we're going to edit and archive, and actually just started a website where we're going to start posting those things to be able to get out to the broader community as well as our patients. So as a participant, you would log in, you just hear soft music, and then at 10 o'clock, either I or some of our behavioral health providers have been jumping in and doing a quick 10-minute mindfulness session. So there's like a plethora of meditations out there. There's so many. So it depends on what day and who's doing it. It could be some guided visualization. It could be a body relaxation technique. It could simply be just being aware of your breath. And, a lot of us, we're not in our bodies all day, right? We're up here in our brain working. We're stressing about things. I can go all day long and not realize I have to go pee because I'm just sitting here at work. So there's really value about taking that moment to bring yourself back into your body, gearing you up, and you're more productive. You're a better person. You're able to regulate your nervous system better. So that's the 10 a.m. one. And then, there's also something about making things fun. Another type of meditation is active or expressive meditation. There's many different types. You may have heard of forest bathing, for example. It's kind of been a popular thing recently, where you walk in the woods and you walk in a mindful way. So you heighten all your senses. You're super aware of your surroundings. There's all different types of walking meditations. And the one that was promoted quite a bit through the training that we did was shaking and dancing. So indigenous cultures, thousands and thousands of years ago, used shaking and those type of movements, sometimes to get into a trance state, very effective for that. But also it breaks up holding patterns in our body. We're crouched over a desk all day, also holding patterns around emotions. And so taking 5 minutes to literally just shake your body. We all know how good exercise is. You're getting your juices moving around your physical body, but also your emotional state. Sometimes it can bring up emotions. People cry. I know the first 2 days I did the shaking and dancing exercise, I got tearful, with what was going on. I wasn't even feeling that emotional state till you shake things up and move things out. The second part of that is then dancing. So you get things moving, feel how you feel in your body, and then you put on music and you dance. And the dance requests for music are all over the place. There's something very joyful in then being liberated and being able to move. Super powerful. And I know for some of the people who join the dancing, that's the only physical exercise they're getting. Really, really powerful. And then once a week, I've been doing a eating meditation, but not as popular. But it's an opportunity to use, you've probably heard the phrase, chop wood, carry water. That's everything we do through our day is an opportunity to be mindful, just being super aware. And so you could mindfully wash the dishes. You could mindfully vacuum your floor. So you're just taking the opportunity of eating your food, being fully immersed in that experience of eating your food. So some of you have been on a few of those. So I invite people to bring their lunch and I just guide them through, that process. And it's pretty interesting. Sometimes you're not even really hungry, but you eat because it's noon. Taking a moment to reflect on where your food came from. There's a whole, just being able to sink into the feeling of gratitude is medicine. What does it feel like to fill your body up with that emotion? What does gratitude actually feel like? We could go into the science behind, all the beautiful things that triggers in your body. We often don't take a moment to experience gratitude. So using your lunch in front of your desk, whether you're at your kitchen table right now or the office, to just take, literally 10 minutes and sink in and feel that.
Dana, is the lunch one guided or do you give prompts or something? Like where your food came from and all that?
Mm-hmm.
Is that?
Yep.
Yeah.
Yep. It's a whole guided thing.
Okay. So do you eat your lunch during that time?
I don't. And just to be clear, we get through one bite of food in those 10 minutes.
Oh, okay. Okay, got it. Oh, I had no idea. Yeah, I didn't know what it was. So have you heard anything? I know you said people were like, I really appreciate the reminders. Are there other things that folks have shared?
I mean, no, I've gotten nothing but positive feedback. I've had several of so the other flip side of this is we have a lot of talent within our organization around some of these skills. A lot of our medical providers, some of our nurses, certainly our behavioral health providers often teach their patients some of these things when they're in the room with them. And so I've been utilizing now these time slots to record other people. It can't just be me, right? Other people and some of the things that they're teaching. And what I'm really excited about is to be able to package that in some way for our staff, for our patients, and for our bigger community around, there's something, we've got all of these patients right now that are stuck inside, they're stuck in their homes, and there's medicine in just hearing the provider that they have a relationship with's voice. And, is there a way to capture that and have that available to patients? So we just brought on someone who's designing a blog style website, just got some editing software. I've been recording all of those morning things and then doing some one-offs with individual providers and then packaging that so they're super quick, 10 minutes. People can't sit and listen for anything much longer than that, even in a good state. And then, being able to get that out to our patients. We have patient portal, right? A link to videos can go out.
Oh, that's cool.
Using our social media, linking to this blog site. We have at our organization, we have our wellness center. So we have integrative services built into how we're delivering care. And, we've got heart math, we've got yoga instructors, Qigong, we got all this stuff there. So there's a way to squeeze that out and get that out to a broader audience. So kind of beyond the mind body package skills that we learned through the collaborative, but, going bigger.
Awesome. Dana, thank you so much for sharing with us. Take care, everybody.